Hi everyone, my name is Samantha and today we'll be presenting on my topic of erysipelas. What exactly is erysipelas? Well, erysipelas is a severe bacterial infection that affects the skin, primarily the epidermis layer of the skin. It's actually very similar to another condition called cellulitis. Only difference between these two is that cellulitis only affects the deeper layers of the skin, such as the dermis and the subcutaneous tissue. It's also worth noting that infants and the elderly are more susceptible towards erysipelas. Causes. This bacterial infection's primary cause is group A beta hemolytic streptococci. It's rarely ever group C or group G, however, these are some exceptions. Erysipelas develops when this bacteria enters the skin and then directly invades the lymphatic system. This can be done through cuts, sores, or even bites. Symptoms. Some symptoms include vibrant rashes, redness, tenderness, fever, fatigue, headache, and vomiting. Actually, in most cases, individuals experience the notorious red rash last, and fever, fatigue, and vomiting come first. Characteristics. Erysipelas has very distinct characteristics, which makes it very easily diagnosable. The bacteria causes tender, bright red rashes on the skin. The affected skin is sharp and contains a raised border. The face and legs are usually affected by the infection the most. However, it can also occur anywhere on the skin. Treatments. Fortunately, erysipelas is very curable. Here are some of the general treatments. Cold packs to reduce swelling, compression socks, elevation of the infected limb to help the swelling, and saline wound dressings. Antibiotics. Because erysipelas is a bacterial infection, penicillin works very efficiently. Penicillin is the most common treatment plan. It can be administered orally and intramuscularly. For those who are allergic to penicillin, erythromycin is a great substitution. Recent news. Erysipelas is an infectious disease that frequently occurs in elderly people. Surgery, obesity, diabetes, and venous insufficiency and lymphedema are the probable risk factors.
HPV. What is HPV? HPV stands for human papillomavirus. HPV is the most common sexually transmitted infection. Chances are you can contract some form of HPV virus in your lifetime and not have any signs or symptoms. Causes. It is transferred by skin to skin contact. Genital HPV infections are contracted through sexual intercourse, anal sex, and other skin to skin contact in genital region. HPV can cause cervical cancer, including cancer of the vulva, vagina, cancer of the penis, or anal cancer. Symptoms. Most people don't have symptoms or health problems, but can cause genital warts. Genital warts appear as flat lesions, small cauliflower-like bumps. In women, genital warts appear in the vulva, but can also occur near anus, on the cervix, or vagina. In men, genital warts appear on penis, scrotum, or around the anus. Common warts appear rough, raised bumps, and usually occurs on hands and fingers. Plantar warts are hard, grainy growths that appear on heels or balls of your feet. Flat warts are flat top, slightly raised lesions, can appear everywhere. Children usually get them on face, and men get them in beard area. Treatment. Genital warts can go away with treatment from your healthcare provider or with prescription medicine. If left untreated, genital warts may go away, stay the same, or grow in size. For cancer treatment, while it is small and before it spread, take screening tests such as the Pap test. In this picture, we have the plantar wart. This one will be the common wart, the flat warts, and then this one is the male genital warts.
So conjunctivitis is also known as pink eye. And what it is an inflammation of infection of the conjunctiva that lines your eyelid and covers the whites of your eyeball. As the small blood vessels in the conjunctiva becomes more inflamed and irritated, the more the whites of your eyes will appear red. Pink eye is commonly caused by a bacterial or a viral infection or an allergic reaction. And since pink eye is caused by different ways, it will show different symptoms. For instance, for a bacterial infection, it will produce a yellowish discharge in the eye, which can leave your eyelids sticking together. And in some cases, it can occur with an ear infection. As for viral infections, the discharge in the eye will normally just appear more watery. Usually, this starts in one eye, and within a few days, it can spread to the other, and it can occur with a cold, flu, or other respiratory infection. And for allergic reactions, normally this occurs in both eyes, and this produces an intense itching, tearing, and swelling in the eyes. For treatments, if it is caused by a bacterial infection, if it is mild, it may get better within 2 to 5 days on its own, and it could possibly take 2 full weeks for it to go away. If it is more severe, doctors may prescribe an antibiotic, usually given topically as eye drops or an ointment. Antibiotics may help shorten the length of infection, reduce complications, and reduce the spread to others. For viral infections, normally this shows up as a mild case, which clears up within 7 to 14 days. And in some cases, it can take a full 2 to 3 weeks. Doctors may prescribe antiviral medication to treat more serious forms of conjunctivitis, such as conjunctivitis caused by herpes simplex virus or varicella zoster virus. Antibiotics will not help treat pink eye if it is caused by a viral infection because it is not effective against viruses. As for allergic reactions, normally they will go away on its own within 7 to 14 days, although if it is too irritating, doctors will recommend you to get a cold compress or eye drops for your eyes. And because it is caused by allergens such as pollen or animal danders, people will feel better once they remove the allergens from their environment.
Hello, everyone. My name is Nguyen. Today, I'm going to talk about blepharitis. So, blepharitis is an inflammation of eyelids. It usually affects both eyes along the edges of eyelids. It commonly happens due to clogged oil glands. These glands located at the base of eyelashes. It is known as the most common cause of dry eyes, and it's often a chronic condition and which is difficult to treat. It's non-contagious and does not affect eyesight. People who got blepharitis, they may experience some symptoms like watery eyes, red eyes, a gritty, burning or stinging sensation in the eyes, eyelids that appear greasy, itchy eyelids, red swollen eyelids, flaking of the skin around the eyes, crusted eyelashes, eyelids sticking, more frequent blinking, sensitivity to light, and blurred vision that usually improves with blinking. There is no exact cause for blepharitis, but it may associate with one of these factors: eyelash mites or lice, seborrheic dermatitis, rosacea, dry eyes infection, clogged oil glands in eyelid, and allergic reaction to products like contact lens solution, eye medication, or makeup. When you got blepharitis, you may keep your eyelids clean. And doctor might recommend artificial tears, antibiotics, or antiviral drugs, a type of plug that block your tear ducts in order to keep more tears in your eyes.
Rubella German measles. Rubella German measles, otherwise known as 3-day measles, is known for its distinctive red rash. It is a positive single-stranded RNA with an envelope. It is a part of the Tocaviridae family. This virus replicates in upper respiratory tract, disseminates to all parts of the body, crosses placenta, damages embryo or fetus. Infections for children usually occur late winter and early spring. High-risk individuals are children and young adults, and more high risk for pregnant women. The transmission for this virus is through droplets or direct contact with respiratory secretions of an individual and can transfer to mother to fetus through placenta. Signs and symptoms for children are they can experience a rash, a low-grade fever, headache, general discomfort, swollen and enlarged lymph nodes, cough, and runny nose. Signs and symptoms in adults include a mild illness of a low-grade fever, headache, pink eye, sore throat, and a rash that starts on the face and spreads all throughout the body for both children and adults. Complications for this virus are women, mostly 70% of women acquire arthritis. In rare cases, brain infections and bleeding problems. Serious birth defects include heart problems, loss of hearing and eyesight, and intellectual disability. The incubation for this virus is usually 2 to 3 weeks. The period of illness lasts 14 to 23 days, and the contagious period is most easily spread 5 days.
ART, and those are for people who have HIV already, and for those who are negative in HIV can take PrEP, which is a pre-exposure prophylaxis. Using condoms, choosing less risky sexual behaviors, reducing the number of sexual partners, and not sharing needles, syringes, or any other injection equipment can also help prevent HIV. CDC recommends everyone from ages 13 to 64 to get tested for HIV. Sexually active gay and bisexual men with more than one sex partner should get tested every 3 to 6 months. If they're a regular partner, it should be at least once a year or more. Some symptoms of HIV are in different stages. You have stage 1, which is acute HIV infection, which is 2 to 4 weeks after the infection of HIV. 2/3 of the people will have flu-like symptoms, and it's the body's natural response to the infection. Some people might not even have any symptoms in the early stage. Stage 2, which is clinical latency or chronic HIV infection, and that is when the virus multiplies at slow levels. And the last stage, stage 3, is AIDS, which is acquired immunodeficiency syndrome. Some people can get rapid weight loss, recurring fever or night sweats, tiredness, swelling of lymph glands in armpit, groin, or neck, diarrhea lasting more than a week, sores on the mouth, anus, or genitals, or red, brown, or pink blotches on or under the skin inside the mouth, nose, or eyelids. There are several symptoms of HIV. Not everyone will have the same symptoms. It depends on the person and what stage of the disease they are in. Most people in the U.S. with HIV do not progress to AIDS due to effective treatment. Some current events with HIV is that the Biden-Harris administration marks World AIDS Day 2021 with renewed commitments to end HIV and AIDS epidemic by 2030. Another one is that they have a #SheWell campaign to increase PrEP awareness among women and healthcare providers. And the last current event for HIV is that CDC awards $117 million towards ending the HIV epidemic in the U.S.